There are lots of questions about the new COVID-19 vaccine now that it is available.
We asked Dr. Kumar to answer some of those concerns. Joining us now. Appreciate you taking some time. Thank you.
Good morning.
So who should get the new COVID vaccine?
Well, the CDC is recommending that all Americans aged 6 months and older get the vaccine. Now, this is a very broad recommendation. I think there's two messages being sent here. First, for the American public to view this no differently than they view their annual flu shot. And second, to really uphold public safety and public health, we need to have broad vaccination policies. Not only will we be protecting young children, but we'll be protecting the adults that live with those young children. The highest risk populations do remain the same. That's our immunocompromised individuals, people over the age of 65, people with diabetes, obesity, and pregnant women. And those are the patients that should be prioritized.
Doc, where can people get the new vaccine at this point?
Well, the vaccine will be available in doctors' offices and pharmacies by the end of this week or early next week. So you just sort of want to check in with your local community healthcare provider to see when they have it in stock.
And what about the flu shot? Should people be getting this together?
Well, it's certainly a safe and efficient strategy. I mean, it's absolutely safe to get the COVID vaccine and the flu shot. There is some hesitancy amongst the American public because they're worried about side effects, but researchers have actually studied this, and they have found that the side effects are really not much more if you get the COVID vaccine alone or if you get it with the flu shot.
Doc, let me ask you about kids. I was with my son yesterday. He's like, I got to get another shot. You heard it over the radio. For children, if they've never been vaccinated or if, let's say they've already had COVID and had it somewhat recently, should they get the new vaccine?
Well, so if children have not been vaccinated, then they are unprotected. And kids, even healthy kids, can get quite sick and become hospitalized with COVID. Now, if you have had recent infection, whether you are a child or you are an adult, you want to wait at least 90 days before you get the vaccine.
And does this new vaccine protect specifically against new variants?
Well, this new vaccine is formulated to target specifically the XBB strain. Now, the variants that we have circulating right now, which account for about 40% of new cases, are subvariants of XBB, which means that they're close family members. And you've seen numbers being thrown around, EG5, FL151. Well, these are, let's just say, the brother and sister variants to XBB. So this new vaccine that's coming out will protect you against those predominantly circulating variants. Now, there is a third variant that is being monitored, BA.2.86. Both Moderna and Pfizer have reported that this new vaccine does in fact protect against that third variant, should that become an issue later this winter.
And Doc, last question before we let you go. Any side effects that you're hearing of at this point?
Well, at this point, the expected side effects are the same side effects that we've seen with previous COVID variants: nausea, vomiting, headache, chills, some body aches, maybe even a minor fever, but they're short lasting, and the side effects are really significantly less than getting actually infected with the COVID virus.
Dr. Nidhi Kumar, thank you so much for taking some time to talk to us today. We appreciate it.
Thank you.
Thank you, Doc.